I am Dr. Mollie James. Tonight we have a really exciting topic. So I took my medical curiosity and my love for shopping and put them together the last couple of months to bring you state-of-the-art functional testing. So we are going to get in that, but just for a moment, I want to introduce a couple of people. So Dr. Kaler, I'm going to bring you up as a panelist. And Chelsea, I'm going to bring you up as well. So if you can accept that, and I'll bring you up. All right. First of all, we have a new physician in our office. So I would like to introduce to you Dr. Michael Kaler. Doc, can you come on? There he is. Dr. Kaler is in the top corner there. Do you want to unmute and just say hello and a little bit about yourself? You're muted right now, though. Still muted. Let's see. Ask to unmute.
There we go.
There we go.
Hi, I'm Dr. Michael Kaler. I've been a primary care physician for about 7 years now and very excited to be working at James Clinic.
Yeah, we're excited to have him. If you call in the next week or two, he'll be starting out with sick visits and then getting up to speed. He comes with a plethora of knowledge in areas we work in. So thyroid and hormones and things like that, as well as urgent care. So we will expose him to all the things James Clinic does in time. And he's getting that trial by, what do they call it? Learning by fire hose.
I think you're mixing drinking from a fire hose and trial by fire.
We're going to do both this week, so he's going to have a good time. But anyway, we're very excited to have him with us. So if they do offer an appointment with Dr. Kaler, this is who you will see. So thank you, Dr. Kaler, for being with us tonight. So when we talk about that, you may be seeing Dr. Kaler for your follow-up and interpretation of the labs. And in the bottom, if your screen looks like mine, you see Miss Chelsea Perry. So Chelsea and I go back, what, 2 or 3 years now, dear? You can unmute, say a little bit of hello.
I became your patient January of 2023. My name is Chelsea. I am technically a registered respiratory therapist with a bachelor's degree, and I've went from patient to employee because I love Dr. Mollie and what the James Clinic stands for.
Chelsea is actually joining us as our testing specialist. So she's going to be leading the charge as you decide you want these tests. You may be seeing her to get them scheduled and doing the tests in the office. Very good. Thank you both. I know, Chelsea, you're driving, so be careful. All right, we will get into the presentation tonight. Let me share my screen here. All right, so state-of-the-art functional testing is the topic of the evening. So we need to start out by talking, why do we need a different kind of testing? What does that tell us that traditional testing doesn't get into? And then we're going to talk about some of these very cool tests that we have introduced and are introducing. So when you look at traditional testing, this is going to be your traditional lab tests. When we look at the brain, cognitive studies, so the mini mental status exam is about the best we have. Most of these are self-reports. So if you have a patient with a concussion, say, and you ask them, do you have a headache? Do you have nausea? Do you have double vision or blurred vision? Do you have photophobia? Or does the light bother your eyes? It depends on what their motive is, how they're going to answer that. So if you have an athlete that wants to get back on the field and doesn't want to be down and sick and miss the season, they're going to underreport. If you have somebody who may be wanting to get some disability benefits or something like that, they may overreport. So with the brain, we have I'll call it gross, most of these, it's gross macro testing. We have imaging studies of the brain that have a low level of detection for certain things. Something has to be 0.5 centimeter to show up. So we have that with the brain. On the heart, we do an EKG. It's about 10% sensitive to all the things that we could find. We also have an echocardiogram, which is actually one of my favorite tests, and it looks at function. But the gold standard testing for the heart is actually an angiogram if we're looking at ischemic changes and things like that. Left heart obstruction, how blood flows through and around the heart. Heart testing is great, but it's also fairly limited. There's a huge population of people right now who are out there who have cardiac symptoms, who go through all of the testing, a Holter monitor, an event monitor, all kinds of studies, and come up and say, well, nothing's really wrong. For the vasculature, for the blood vessel health, we have, again, suboptimal testing. Anybody out there with high blood pressure, you can raise your hand. Has anyone ever heard of 24-hour blood pressure monitoring? Again, feel free to raise your hand. Did any of you know that 24-hour blood pressure monitoring is actually the gold standard when you're treating a patient with high blood pressure? So 99.9% of offices do not offer 24-hour blood pressure monitoring. We actually have one. We are not using it right now, but I would love to introduce it. That is not one we're going to do today. But when we look at the vasculature, really, again, gross studies, we're looking at things like a carotid duplex, where we ultrasound the major arteries to look for obstructions. We do Doppler studies to look at flow through those arteries to tell us relatively about the health. Really, the best way to image the liver is ultrasound, is probably the most sensitive, followed by CT scan. And the problem here isn't necessarily that the imaging is bad, the action is the problem. So again, you don't have to raise your hand on this if you don't want to, but how many people on this call have been told that you have fatty liver as just a passing commentary and no one ever did anything about it? They never said there's a plan. It's just like, oh yeah, you have fatty liver. Well, that's really important because the liver is the main organ. We've got the heart, the brain, and the liver is number 3. If your liver goes down, you go down. I worked in a liver transplant center, so ask me about that later. And last of all is aerobic metabolism. So this is really going to get into the fusion of, the illness to wellness spectrum. So our max VO2 testing, or the ability of the body to turn food into energy. If you look at the very sickest patients on the cancer end of the spectrum, we can use this as a resting measure to see how sick they are. And at the top end of the spectrum, our most elite athletes are doing max VO2 testing to try to optimize their metabolic performance. So this is actually a test of active metabolism. So let's get into the testing and what we're going to talk about tonight. So the first test we actually have had, we launched this last summer, but a lot of you may not even know about it. This is the brain gauge. What it tests is reaction time and processing speed. It looks at sensory discrimination accuracy. So can you feel one finger over another finger, or can you discriminate which finger the wave is big enough? Cortical efficiency. So how fast did electrical impulses flow through your brain? Neuroplasticity markers. So how fast can you learn something or your brain rewire things? Cognitive fatigue and overload patterns, and then subclinical concussion or neurologic stress. All of that can be elicited out of this little setup or device. So you'll see this in the office. This is a neurologic lab in a mouse. So this comes from 20 years of research at the University of North Carolina. This is an entire neuro lab. And what's really fascinating, Dr. Mark Tomerdahl is one of the people who developed this, and he's been on my podcast, and we got into this. And neurosciences is fascinating, but it is also extremely dry content. So I will try to hit the high points for you here. Basically, if you look at testing, until this device came out, we hit a floor, if you will, on how fast of cognitive processing speed we could get to. And I think it's in a range of like 0.7 milliseconds. So this can go to 0.2, because when you get to 0.7, your mouse and your computer conductivity cannot respond faster. So this device actually bypasses all of that. It plugs directly into the tablet. So as you're answering questions, it is testing your speed because all that happens here. It doesn't require it to travel into the brain of the tablet. So it bypasses all of that. Based on 20 years of validated research out of the University of North Carolina, before now, they actually mostly marketed this to neuro researchers. This is fairly new on the clinical scene, and we are one of the first ones to do that. So you're going to sit in front of our tablet with that fancy mouse. It takes about 10 or 15 minutes. It's a little frustrating if you've done the test because it asks you, it's very subtle differences that it asks you. So it's non-invasive, there's no imaging, no radiation, no needles. It's repeatable a whole bunch. So what does it actually tell you? It's going to give you a couple of these. And now this is a perfect test with all green bars. This is what you want to see. It'll tell you these, I think it's, what is it, 3, 4, 5, 6 areas of focus. It detects dysfunction long before you would have any imaging abnormalities, and it tracks recovery optimization over time. So if we look back at this one, these are all different testing points that were done over time. So we really want to integrate this to establish a baseline and then see how the interventions that we're doing, we not only have to help people, we have to show you how we're helping you to justify it. So looking at the score over time is our objective data for this. So it can, and what's really cool is if you have the home unit, which we recommend if you don't have all green bars, you can really hone in on your sleep and your circadian rhythm, neuroinflammation strategies, and cognitive performance. So he had some of his research assistants, and they would do this like after a night of drinking, after 2 coffees, after 3 coffees, and they would really figure out where their sweet spot for neuroperformance was. And then they would kind of have a little bit of a hack. So here is actually what it tests. So the metric over here, speed, it tells you what it is, efficiency of basic sensory processing and reaction speed. So I won't read all of these, but fatigue, rate at which neural processing declines under sustained challenge. So it asks you to do the same thing over and over and over and determines if the timing gets longer. And then it gives you a cortical metric, which is their trademark name for the overall score of mental fitness. Now, if your score looks like this, where you've got some yellow bars, which mine look like, do not feel bad or fret, you can actually purchase the at-home unit. I think it's $650, $750, something like that. You hook it into your mouse. If your bars are not all green, you can do the brain training. And we know this from multiple cognitive studies that brain training improves outcomes. So early dementia patients, they try to get them doing this. You've seen like the Sudoku puzzles and different apps and things that challenge the brain. Well, this does it in an organized and proven method. Now, this is an interesting connect the dots. I don't ever want to make false claims. But if you don't have all green bars, you can make them potentially all green with a number of interventions. The brain training with the actual device, things like hyperbaric oxygen, peptides, MDI, things like that can help you improve your scores. And then part 2 of that is no one who has all green bars has gone on to develop dementia. So putting 2 and 2 together, can we use this as a tool to monitor for and risk reduce the chance of getting cognitive issues over time? Brain health. I'm going to go back to this slide. This is $125 if somebody walks in off the street to do it. If you are a legacy or new concierge patient, it is no charge to you. This is complimentary, and I would recommend that you do it every 3 months as a minimum testing. So this can be scheduled separate from your appointment. I highly recommend when you're coming in for an appointment with us for like a lab review, your annual whatever the next time, schedule a brain gauge prior because we can actually go over these results during your appointment and make some recommendations for you. Next is the MCG, the multifunction cardiogram. So it tests really 2 things. So the first one is early ischemia or reduced blood flow in the heart. This isn't there's 2 parts to the test. So that's the FDA approved part. And then there's kind of the experimental part, which tells the clinicians where to look for the dysfunction. What it tests for part 1, this is the FDA cleared section. So it's actually going to give you a score based on how many parts of your report show ischemic changes. Okay, this is FDA cleared. They're using this in urgent cares. They're using this in ERs with people who have active ischemia. And I believe if the score is 4 or more, so if you're a D or higher, it's been validated to show acute ischemia. So if you're under 4, the chance of you having active ischemia is extremely low. And they did a comparison between this and an angiogram to come up with those recommendations. So you can see here, we all generally want to be in an N or an A situation, and we want to stay out of the red zone. But they also can improve fairly quickly with the right interventions. So I'm going to skip a slide here. This is what that part looks like. So the test actually, you lay on a table like this, and I call these jumper cables. So you're going to have a jumper cable attached to your wrists and your ankles, and you'll have one lead on the left ribs just under the breast and the anterior axillary line. So if you draw a line straight down from your armpit, it's going to be right there, kind of where the ribs are. You lay there for about 7 to 10 minutes, and what it's going to do is take 5 82-second tracings. And there has to be no electrical intervention, so all metal's out of the pocket, no cell phones, no belts. We've got to have all the metal off. We found that even these tables plug in, we have to unplug the tables or use different devices. We can't have any electrical interference, no other things plugged in around the device. You don't want to have any exercise or exposures in like the last 12 hours prior to this. And here's what it looks like. So these are the 5 EKG tracings here, 5 unique tracings. Here's the time that they were taken. Here is the tracing quality. So you can see these were all good. We're going to look here under local ischemia. And on this one, there's a few borderline local ischemia, but absent here, and then global ischemia. So this is one vessel. Remember, there's multiple vessels that serve the heart. So this is looking at individual vessels. This is looking at the heart overall. So more of a global picture. And you can see pretty much absent. And if you look at the severity score, this is a very happy patient with zeros. So this patient scored extremely well with an A. So the next part of the test takes those same 5 EKG tracings and it gives us point scores. And we can use these different point scores just to kind of direct us where to look. So what it actually does is it takes your 82 seconds times 5 of EKG tracings, and they have a database that is bigger than Google's database. Terabytes, huge terabytes of data, and they're going to compare your EKG leads to all of these other EKG leads and say it looks like this pattern of problems. And it'll give us a point score based on that. So you can see this patient scored under both. Let's see, these are, I copied this in wrong. So it scored under bradycardia. I copied the same one twice. But it was a very clean recording because the patient had hardly any points. There's two different sets of information. You have acute power failure. So if it's mitochondrial, we're going to see this. If there's arrhythmias, we'll see asynchrony, decreased ejection fraction, myocardial remodeling, things like that. It looks at rheumatic heart disease versus pulmonary heart disease. It looks at left ventricular hypertrophy. So it gives us a score to tell us where to look and what to think about clinically from more of a functional standpoint. Going back, this test is $1,000. Your discounts under your new concierge plans apply to this. The legacy plans do not get discounts on this. So again, we'll talk about reasons to potentially upgrade at the end. But that is the MCG. So I will give you an anecdotal case on this that my brother will not mind me sharing. He had really bad COVID. You know, that was one of our first patients when we opened James Clinic. We treated him with hyperbarics. He was off oxygen in 4 days, back to work in 7, where he would have been on a ventilator and die in the ICU at about day 14 per all of the other 2,000 patients that I had treated. So after that, he's had several episodes of chest pain. He's gone to the ER. You know, there's not a lot I can do if I'm not right there and I don't have the right equipment. So we've ended up recommending he go to the ER. He's gone in, he's had the EKGs, he's had the troponins, he's followed up with cardiology, he's had the stress test, he's had the echo, like he's had the full gamut of workup. But he's a 40-something male who, you know, used to be fairly overweight. So basically, I told him, like, stop going to the ER. It's not your heart. You're not having a heart attack. So it can provide a lot of peace of mind in the right setting when used properly. So worth it to buy the machine, by the way. So multifunction cardiogram, again, it's going to be helpful if you have cardiac issues and you're not getting answers, if you feel like they're missing something, if we need an argument to dive deeper into things. This can kind of tie us back to things like the mitochondrial issues, thyroid issues, MTHFR issues, microvasculature problems, which we're going to talk about next. So the new testing is the glycocheck. So you guys have seen the picture of the inside lining of the artery. A lot of you have in the clinic. If this is an artery cut in half, a cross section, you can see there's these little eyelashes or little seagrass type protrusions all around the inside lining of the artery. So here it is blown up. Apparently it took them 4 years just to get this photograph because it's electron microscope, and they kept losing the glycocalyx when they broke it down. So this is called the glycocalyx. There is kind of an aloe vera type jelly that lives in this, and these have sensory fibers. So what it does is as blood flows by, it actually senses the speed of that, helps regulate the nitric oxide, and helps protect the lining of the arteries. So theoretically, the blood never touches the endothelial lining. Well, if you paid much attention during COVID, endothelial dysfunction was actually one of the big problems. So COVID mowed this baby down. It was super unhealthy. So lots of blood clots, strokes, heart attacks, things like that. Now, most cardiologists, nephrologists, interventionalists, they're going to talk to you about the 1% of arteries that have names, right? Your carotid, your aorta, your renal arteries, things like that. But 99% of our vasculature is the microscopic capillaries, what actually delivers oxygen to one or two cells. So this is what we care about more so than this. So we have a test that we can go under the tongue with a microscopic video, and we can look at the capillary density, the capillary blood volume. We can look at blood flow. We can look at the glycocalyx function based on the perfused boundary region. So I'll explain what that is. So how deep do red blood cells invade into that grass type substance? That's really where we get the health score. So we want that to be low. The PBR needs to be low. We want to see a nice, thick, healthy glycocalyx here. So how does this work? So there is some prep to this test. You don't eat for about 4 hours before, you don't exercise, not drinking alcohol would be ideal. You want to hydrate before this, and then this would be the hardest for most of us, avoid caffeine the day of. So it's going to look like this. You're going to lay on the bed. We have this little video camera. It's going to go underneath your tongue. You're going to actually look at the single red blood cells traveling through your capillaries. And then these captured videos over about 4 minutes are going to go to an AI program, which are going to measure the depth of the glycocalyx and look how far the red blood cells invade into this layer that it shouldn't and give us a score. So pretty cool. This test is going to run $375, and again, the discount on the new concierge plans will apply to this. Very excited about this. It'll give us a microvascular health score. So why do we care about that? So obviously the heart has a microvasculature, but think about it, all the other organs in the body do too. So the brain, if we can make the glycocalyx healthier, your brain's probably going to get better. If we can make that healthier, your kidneys are probably going to work better. For gentlemen, your performance is probably going to improve if we can improve blood flow to those delicate capillaries. So it has a lot of real life clinical applications, not just for the heart or for the blood pressure. The next test is looking at liver health. It's called the FibroScan. So again, fatty liver is a very common thing that people come in with the absolute epidemic of metabolic syndrome. So this will look at the liver fat content or steatosis. It'll look at how stiff the liver is getting. So that's your fibrosis and your scarring. We want to catch this before we get to cirrhosis. Non-alcoholic steatohepatitis or fatty liver from diabetes and metabolic syndrome is actually replacing alcohol as the #1 cause of liver transplants in the United States. If you're out there drinking sugar pop with high fructose corn syrup in it, direct liver toxin. That fructose bad news. Agave syrup, bad news. You don't want to be on any of that. It will actually score the stiffness of your liver. This is going to look like it's non-invasive. So you're going to come, I don't think you eat for a few hours after. You're just going to lay there. You're going to have the right upper abdomen exposed, and it's a type of ultrasound that has specific measuring and grading of the tissues. So again, it takes about 10 minutes and no radiation, no sedation. And then out of this, so it's going to give us a score up here of how fatty the liver is. Is it minimal to none, moderate, severe, or extensive? And then if it's above 0, we will develop a plan to help bring it down. So very important for people with insulin resistance. This is a way to actually look at it real time, score it, and you have a functional marker. This also is tied to inflammation, cardiometabolic risk, because it all goes together. This is silent. For a lot of people, they don't know that the liver can compensate all the way up until the end and then it falls off a cliff. So we see this a lot. If you've ever known anybody who was a bad alcoholic, like they were totally fine until like they broke their ankle and then they died. Because when that happens and their body goes under stress and then they go under anesthesia, the few liver cells that were functioning and holding them over the cliff die and they're gone. The max VO2 testing is probably the most complex and involved testing that we have. We've actually had this device for a while, but until we got into the new space, we didn't have a place to put a treadmill. So we're very excited to bring this in. The VO2 max, so this is what volume of oxygen can you utilize to create energy? That's what this is looking at. This is one of the number one top predictors of longevity. So this and muscle mass and the VO2 max is based on your muscle mass and how well, this is that aerobic side of things. So if you talk to anybody in training, there's kind of this debate, do I do weight training or do I do cardio? And what's the balance? And now they've said, quit doing so much cardio because you need to build more muscle mass to lose weight. But the cardio is what helps you produce energy. So this is what speed athletes need. This is what endurance athletes need, things like that. So this is going to look at your aerobic versus your anaerobic thresholds. So if any of you are training into that zone 3, 4, 5, the anaerobic threshold is at zone 4-5 when you start building lactic acid. So that where you run so hard or work so hard you're going to puke, that's that anaerobic threshold where you get to that point. The test can also tell us what is the ratio of fat versus carbohydrate metabolism. So for athletes, it can help balance out the diet so that they get what they need and what they burn. It can look at the metabolic efficiency, and again, that training zone precision. So like what heart rates do you need to be at to be in the certain zones? So again, $375 is the price of this test. It takes about 30 minutes. This can be done resting or active. So if somebody who's a cancer patient that might want to do this, you're like, they're not going to run, and get their heart rate to 160 on a treadmill. That's okay. They can do it resting. My elite athletes are going to do it as an active. If you're working on those New Year's resolutions, you're like, this is the year I'm going to get in shape. This is what I'm looking to do, and you might want to do as your baseline. So then as you're training, you can actually see objective progress as you're going. So what this mask measures, this is the most challenging part. You're going to have a mask and you're going to breathe through that mask. And that mask has sensors in it. So there's oxygen and carbon dioxide monitors in here, and it can tell us how much oxygen you're utilizing. So you get a report something like this that gives you scores in high intensity performance, recovery ability, fat burning efficiency, and a number of things. Breathing and cognition. So this is a good one. Some people have less blood flow and they don't make as good of decisions. So if you're in like a high speed sport like soccer, you've got to maintain the ability to make those snap decisions like a race car driver. So this kind of tells you if you compensate when you get to those high performance levels. So how well your engine converts fuel into power. So this is a fun test. It applies to a lot of people. So tying it all, why are we launching this? Why are we doing this? So a few things. Number one, when we brought in the MDI, the mitochondrial reboot, A lot of people are like, how do I know if it's working or not? Now, some people have very clear, like, I was super tired and now I'm doing this and this and this, and it's very clear. But the MDI has the potential to reverse fatty liver. I would like you to know if you had fatty liver and if you're reversing it so you can decide, is this a treatment I need to invest in and continue? Is this a treatment that's done its job and I'm done? Or is it not working for me and we need to look at something else? So I really, again, we've always tried to do this, not only help you get better, but show you that we're getting better objectively over time. This tells us where to focus, where to go. It's a living test that you can make sure nothing is going to sneak up on you. The brain gauge, if your concierge is totally included, you can do it probably every 3 months. And if you want to ever come in and just do a 90-second, there's a rapid test that you can do too, which is 90 seconds. You can come in and do that anytime. You just remember your little login. The MCG, the multifunction cardiogram, you can see the price here, $1,000. The GlycoCheck, FibroScan, and PNOE are each $375, and the discount applies on the new concierge plans. So I'm going to stop there and take questions, and then I'm going to go to our introductory offer. That's a lot of information. Okay. Does Brain Gauge work with a trackpad on a Mac instead of a mouse? No, it does not. You have to actually use the Brain Gauge device. I believe you can plug it into a Mac computer, but you can't plug it into an iPad. MCG is safe with a pacemaker. If you have known fatty liver, should the patient still get a FibroScan? Yes, you should, because it will grade the severity of fatty liver so that we know what it will do, and then we can do comparative testing. So those are great questions to start with. What test do you suggest if someone was going to do multiple MDI sessions? First of all, our baseline labs, I would absolutely do. And from there, it depends. So probably the FibroScan, if there's any metabolic issues, if there's high blood pressure, cognitive issues, if anything else shows up, I would probably do the GlycoCheck. If there's any cardiac history, I would do the MCG. So I don't think everyone should do everything unless you just want to, which I'm going to because it's good, but tailor it to what we're picking up on the brain gauge and on your symptoms. And when we do your labs, what are we picking up? And then we dive into that deeper. Did any of the baseline researchers, this is on the brain gauge, test while using ADHD meds to determine how that compares to baseline? I don't want to speak specifically, but I'm sure they did because they've looked at different things, different conditions. So I'm sure ADHD is one of them, autism, concussions, cognitive, Parkinson's, alcoholism. They've looked at a variety of conditions and then they compare a before and after. So they're looking at a lot of different interventions, but we could ask him that specific question. He's super accessible to us. All right. Yes, you can all see it. Perfect. Okay. I am going to you guys are all on tonight, I guess, but a new thing you need to know about as our website gets updated under news and events, here is the registration link for the Zooms. So I assume you're all on there since you're here tonight, but if you know somebody who needs to be registered, you just go to sign up, and then down here, I'm not going to show it because I think it has somebody's information, but you can fill that in at the bottom of that screen. Go ahead and add yourself on there. You had to sign up for the webinar. So we have repeatedly shared those out on our social media, on our emails. A lot of people have missed them. So we're just trying to capture everybody and let them know every Monday night at 6 p.m. we're doing something and we will share these. If you're signed up tonight, you should get a replay of this tomorrow. I will have these up on our YouTube channel sometime tomorrow. Yes, somebody who's had liver failure in the past definitely would recommend a FibroScan, depending on what else is going on, potentially the GlycoCheck as well. You're based in Massachusetts, so I'd highly recommend that you travel in to see us. Not very many places have any of these, and we are the only place I know of that has all of them. I'm not aware of a single clinic that has more than one of these tests in a place. So we're it. We are national leaders in state-of-the-art testing, and so come see us. Yes, I will post the summary of the charges. So let me go back to that. There is the summary of the charges overall, and I'm going to get to the introductory special here in just a moment. Okay. Yeah, so for the vascular dementia, again, we are just starting to apply these and see. I truly believe between this testing and our mitochondria and our other things that we have to offer, it's totally going to change how we manage different things. When you look at patients with dementia, again, it's going to depend on how far down the road they are as to how reversible it is. And we have patients in a lot of different states of that are wanting to see improvement. And depending on where your loved one is, the quality of improvement probably diminishes over time. Now, when we're looking at the MDI therapy, they have some pretty remarkable cases of patients who are years out from their stroke that are getting better. So we see crazy miracles with that every day. So it's wild. So again, here are the tests. We learned a lot when we did the MDI packages. And if you are waiting to get your MDIs or your mitochondrial reboot, number one, thank you for your patience. Number two, we did that as an introductory special to gauge interest. It always helps us to launch things knowing what the interest level is and getting people on the schedule. As in exchange for the discount, we appreciate the patience. But we did learn a lot. So tonight we have a similar introductory special, and I do believe we're going to have a second pump in St. Louis within the next 1 to 2 weeks. So I was told it will be shipping out soon. So hopefully we will see that. So here is the introductory special. Number one, this is St. Louis only. This is only in St. Louis right now. If you've been to our Sheraton, Iowa office, you know the only open seat in the house is usually the bathroom, and sometimes that is taken. So only St. Louis right now. We will have you tonight sign up. Katie Pace, my Vanna White, is on time as possible. So if you look in the chat, there is a link, and I will pull that up and share that screen in just a moment. You will sign up at the link via Hint, and then we will be scheduling at a later date. So if we know, if we can gauge the interest tonight, let me share my screen and I'll pull this up and show you what the registration page is going to look like, because it might look a little funny. Okay, so you're going to go to the contact page. Now, if you already have a Hint account, Katie, if you can unmute and correct me if I'm wrong. If you already have a Hint account, it might take you to a login page here. Is that correct? Oh, it won't let you unmute. Okay. So I don't have an account. So let me change this. Thank you very much. Okay. So we're going to put this through here. Go to additional details page. Okay. So just revealed. 5. Do you just put in your information and then say enroll me if you're enrolling for yourself? And then when you get to this page, it is going to look like a one-time registration fee of $1,000. So if you go to the confirmation page, it is a one-time $1,000 charge. There are no recurring bills. So what this does is it throws a note into the chart that we know that you are in the, what do we call it here? The state-of-the-art testing package. And we will keep that on your chart until we get you scheduled. So that's a way for us to track it, but it's a one-time fee of $1,000. So when people ask, what do I get for my concierge fee? What do I get? What's all included in that? One of the things I really like to do is as we introduce new things, I like to give it to our concierge patients at a much lower price so that you can try it. You can see what you think about it. You can tell other people about it. So that is one of those value adds that we have for our concierge patients. Priority scheduling and introductory specials. If you do all 4 tests individually, that would be $2,125. If you were on our top tier concierge plan and getting the 20% discount, it would be $1,700. So this week only, it's $1,000. Just like last time, this is going to be good until 5 p.m. Friday night. We literally had someone call us at 5:01 p.m. last Friday, the last time we did this, and we said no. So do not wait until 5:01 p.m. on Friday and call us. It is until 5 p.m. Friday. So anytime between now and then, the link works 24 hours a day. At 5 p.m., we will remove that link and it will not be able to be used. So anybody who wants to get in on this special, you can. If you only want to do certain tests, then you can do that. So some of you looking at this new menu and thinking about the MDIs might see value in upgrading to one of our new plans, the Foundation or the Apex or the Platinum Executive, if you'd like to be in that. So we have limited spots for that one. And that is not listed on our website. So if you're interested in that, you can message us privately. So that was a ton of information. We have a lot of new things going on in the office. The response to the mitochondrial reboot has been phenomenal overall. The biggest problem people are having with it is actually the glucose load, that they're eating all the sugar and all the bad things and don't feel awesome from that. But otherwise, the outcome, the energy increase and the improvement in other things has been really good. We're excited about that. Okay. Yes, if you have specific questions, you can send those questions through the portal. So most of you, let's see, many of you that I've seen in the last 2 months, I've actually written on your plan of action, MCG, glycocheck, fibroscan. I've actually listed it on there. So can you get this special if you are on the legacy plan? If you are on the legacy plan, you can get the concierge special tonight. So through Friday at 5 p.m., you must be a concierge patient to get this. After this week, the legacy plan patients do not get discounts on testing. So if you take advantage of this special for $1,000 and you need to repeat something in 3 or 4 months, you will pay the regular price unless you upgrade to our Foundation or Apex plans. And the reason for that is when many of you signed up a year or 2 or 3 ago, we didn't have all of these things. So we've now redesigned our packages to account for all of the cool things that we're doing. So some of you get the benefit of those. You get grandfathered in, and some of you again may want to upgrade just to take advantage of that at a higher level on the discount side. Very good. It is. We have 11 minutes left. So if there's any questions, Jeff, we got you down. So we will do that. Oh, the MDI costs. Okay. Ooh, lots of questions. Jeff, I will have someone reach out to you. So Katie, if you can make a note of that, we'll send it to Mary and she can reach out tomorrow on the executive package. John, so the MDI, didn't go into the MDI tonight, but the mitochondrial reboot therapy is $1,000 per treatment. It's about 3.5 hours in the office. That pricing should be consistent over time. And then for patients on the foundational program, they get 10% off. On patients on the Apex program, they get 20% off of each treatment. So, Lisa, when will this be available in Sheraton? I don't want to give you a timeline. I pray before summer, but we have the devices. I don't have the space and I don't have the staff. We have been trying to hire. We've been trying to move for 1.5 years. So we are actively working on it on a daily basis. So as soon as we have room to put it and staff to do it, it'll be in Sheraton. So the devices have all been purchased. They are in our possession. We just need those pieces to fall into place. Yes. So, all right. So there you go. There's all 4. So the MCG, the glycocheck, the fibroscan, and the max VO2 testing for $1,000. You are most welcome for doing these. I enjoy it a lot. Thank you for coming. If you're not sure what concierge plan you're in, if you did not change from January, so if you have not changed in the last 12 days, you are on what we call a legacy plan. So those were 2025 and before. So if you want to upgrade into one of our new plans, you can certainly do that. And you can call the office, you can stop in and talk to somebody. They can go over what's included in each. We have 2 new tiers. I went over that last week. It's also on our YouTube page. the 2026 summaries. Mark, I cannot sign you up for all four. You have to click on the link, my friend. So yes, we can, but you have to do it. I got in trouble for that. So Katie, if you can drop that link in there again. If Brett, if you can go click on that link, they will get you all signed up for those. Brett, my team has spent a lot of time figuring out the testing. We assume that you will want to do all of those tests on the same day. So to start out with, that's the way we'll schedule them. That's why we want our team to schedule, because it'll be in 2-hour blocks. And then once we get everyone who signs up for the special done, then we will open it up to individual scheduling. All right, Mark, if you need help, let us know. But if you can click that link, that is the easiest way to get through it, and we will make sure that you get taken care of. So, all right, everyone, thank you for spending your Mondays with us. Please join us next week. Next week is going to be talking about the terrain program and just kind of reviewing what we do in our terrain program. What patients should expect, what changes we make, what treatments we utilize, how we engage with the standard of care cancer team, medical oncology, radiation oncology, surgeons. Like, what is our purpose and what are our goals? We're going to go over that again. So every Monday at 6 p.m., minus the holidays. Thank you, Lynn, for bringing that to my attention. We're not here on the holidays, but otherwise, we pretty much have this set out for the whole year. So we will be here pretty much every Monday night at 6 p.m. Central. Thank you for joining us. God bless and have a good night.